Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Research over the years has shown that regular exercise can help to reduce risk of cancer and help prevent cancer recurrence in cancer survivors. Now, in fact, a large 2019 systematic review of more than 45 studies, which followed several million people, found strong evidence that regular exercise can help reduce risk of several cancers, including bladder cancer, breast cancer, colorectal cancer, and stomach cancer by up to 20%. The American Cancer Society, in fact, recommends 150 to 300 minutes of moderate intensity exercise per week to help reduce cancer risk. So there's strong agreement that exercise can help to reduce cancer risk, but the question has been, how does exercise reduce cancer risk? Part of the answer has been revealed to us by a 2023 published study in the journal Clinical Cancer Research. So in this study, researchers recruited 21 patients with Lynch Syndrome and asked half of them to perform 45 minutes of intense endurance exercise 3 times per week for 1 year. Now, Lynch Syndrome patients inherit a genetic mutation that results in hundreds of polyps forming in the colon, in the colon of the body, which can easily degenerate into colon cancer. As such, these patients are treated surgically. They're monitored very closely for colon cancer, but they're considered to be at very high risk for colon cancer development because of this genetic problem that they inherited. Now, compared to Lynch Syndrome patients who did not exercise, the group of Lynch Syndrome patients who performed the exercise program for 12 consecutive months, that's 45 minutes of intense endurance exercise 3 times a week, showed that their immune system was much stronger. Now, more specifically, the exercising group showed higher levels of cancer-fighting immune cells called CD8 cells and natural killer cells that identify, attack, and destroy emerging and existing cancer cells and other foreign entities like viruses and pathogenic bacteria. The exercising group also showed lower levels of prostaglandin series 2 hormones, which also suggest stronger immune function. So this MD Anderson study is the first study to show a link between exercise and changes in immune system biomarkers, which help to explain the lower cancer rates in people who exercise regularly. So the 2023 research report suggested that 45 minutes of intense endurance exercise 3 times a week may reduce cancer risk in patients with Lynch syndrome, but it's also likely to help reduce many other cancers due to its immune boosting effects. Of course, there are other ways to help to keep your immune system strong, such as getting adequate sleep, stress management, having a healthy diet, staying at a healthy weight, the judicious use of alcohol or eliminating alcohol, not smoking, avoiding illicit drugs that weaken the immune system. And remember that THC and CBD from marijuana have immune suppressing properties, so they weaken the immune system to some degree. Keeping your vitamin D blood level between 75 to 150 nanomoles per liter, or 30 to 60 nanograms per milliliter. Ideal blood levels of vitamin D are very important to healthy immunity. Consuming adequate immune-supporting nutrients like vitamin C and vitamin E and selenium and zinc. And I think taking an immune-supporting supplement after the age of 50 that contains ingredients like astragalus, reishi mushroom extract, milk thistle, and indole 3 carbinol. I would suggest that all of these practices are important in healthy immunity and by extension helping to prevent cancer as well. But in addition to this, getting the right amount of regular exercise is a proven strategy to help reduce risk of cancer. The 2023 study in Clinical Cancer Research is the first to show us the positive effect of exercise on boosting the action of key cancer-fighting immune cells. So I've included the reference for this 2023 study in the text below, along with other related references of importance. So thanks for watching, and I'll see you next time.